Hello, my name is Dr. Bob DeMaria, the Drugless doctor, and get to know Alzheimer's. You know, it's very frightening because Alzheimer's, which is a form of dementia, which happens to be a part of lack of brain function and memory, can affect anyone, regardless of your socioeconomic level, race. It just depends on what you're putting in your body. And I'm going to briefly talk to you today about what I've learned in my experience when it comes to Alzheimer's and dementia. Do you know, right now as I speak, over 5 million Americans have Alzheimer's. At the peak of the AIDS epidemic, there were only 900,000 people that suffered with AIDS. The amount of money on research for AIDS versus dementia are on two opposite sides of the spectrum. Billions of dollars was spent on AIDS research. It's also estimated right now that 30 million people worldwide have challenges with Alzheimer's. What a frightening statistic. And as the baby boomers continue to age, they feel that that number is going to crescendo. It's going to raise exponentially. Almost $400 billion it costs every year for individuals who have Alzheimer's and dementia. Well, Dr. Bob, what's going on? Well, the latest research is nobody seems to know. But this is what I've learned from my experience and what I've seen, because I interview Alzheimer patients' family members and I ask them what's going on. And the number one item that I always see, they love sugar. Sugar depletes the body of minerals, sabotages your body's ability to make good fat. I'm the author of Dr. Bob's Trans Fat Survival Guide. And in that book, we have a chapter specific just on Alzheimer's. You see, there's a fat in the brain called DHA, Delta Hairy Apple. Do you know that we can assess your DHA levels in your body with a blood spot test, and we could forecast your potential to have Alzheimer's, dementia, depression, and even ADHD because of low DHA levels. I commonly have seen individuals who have Alzheimer's and other brain dysfunctional challenges, not only do they love and have a passion for sugar, which depletes the bodies of minerals to make DHA, they also love convenience food items that have trans fat or partially hydrogenated oils a part of the ingredient package. Do you have a loved one that is suffering from dementia now, Alzheimer's? Assess what they're eating. I've also have done research. By the time that these lack of memory symptoms show up, it might even be too late. Well, I don't ever think that it's too late at all, but let me ask you a few questions. Do you lose your train of thought easy? Do you forget where you place your keys? Do you have trouble times remembering important engagements like birthdays and anniversaries? Do you get confused in the middle of a conversation? How about this? Are you driving along and if you notice that you might not remember exactly where you're at, you more than likely aren't watching this video at this time anyways, but a loved one or family member is. If that's the case, you need to make some really drastic, immediate changes in their diet. What we have found is they have poor fat metabolism. Here's something else that we've discovered over time. Individuals who have exhausted adrenal gland function, the adrenal glands are a pair of glands located on top of your kidneys. On mineral tissue analysis, we notice that they have high aluminum when someone has low adrenal gland function. Some research scientists believe that a part of the Alzheimer challenge could be a protein, a denatured protein that's very common on the brain. What we have also learned is individuals who consume digestive aids and they use drugs to help improve or minimize digestive distress, also have poor protein metabolism in the body. So there are very many possibilities for Alzheimer's and dementia. Inflammation. Inflammation of blood vessels, vascular dementia, inflammation in the body causes blood vessels to compress in size, reducing blood flow. Part of the research has suggested that if people exercise 40 to 45 minutes 3 times per week, they could help increase brain function. I think that is quite significant. Now I'm going to give you a term. A part of the brain is called the hippocampus. Hippocampus. If you have a hard time remember that, just remember hippopotamus. The hippopotamus part of your brain needs zinc. Zinc's important for memory. Wheat and soy deplete the body of zinc. Minimize wheat and soy. That would go a long way to help improve memory function. Exercise regularly. Minimize trans fatty acids. They'll sabotage brain function. Make sure you're taking at least 1 tablespoon of flax oil per day per 100 pounds. And probably one of the best foods that you could ever consume on a regular basis are avocados. I personally eat 1/4 of an avocado every day. The fat that's in the avocado is good for your brain, and there's also a protein in there called carnitine that's important for cognitive behavior. Make sure you minimize sugar. Always drink water from a pure source. Make sure you're eating adequate protein. Minimize any of your digestive medications. Always talk to your healthcare provider. I'm Dr. Bob DeMaria, the Drugless Doctor.